Tonight on Nation to Nation, she's 27 years old and confined to a senior's home with a virus outbreak. Her lawyer says she's not the only young adult in these types of homes.
They've ended up in long-term care because that's just where everybody ends up. It's basically the dumping ground of the healthcare system. If we don't know what to do with them, we'll put them in long-term care.
In Kenora, Ontario, a well-known Indigenous woman has become a potato dealer, all to keep First Nations fed during the pandemic.
I believe it was 10,000 pounds in over 2 shipments to Kenora, and local First Nations took advantage of that.
Hello, I'm Todd Lamourant, and welcome to Nation. Long-term care homes have been hit hardest by COVID-19. In Ontario, there's been more than 1,000 deaths in them. And when you think of these homes, you often think of seniors or elders. But there are a number of young people in these homes as well. Our first guest knows about that all too much. Jane Meadus is a lawyer for the Advocacy Center for the Elderly. Meadus has been trying to help a 27-year-old woman who identifies as Ojibwe for several years to get out of a Toronto facility. And now that home has a virus outbreak. Welcome to Nation, Ms. Meadus.
Thank you for having me.
So how on earth did a 27-year-old woman end up in an old folks' home?
Well, the age of admission for long-term care in Ontario is 18. So it is a right of anyone who has that kind of requirement that they can go into a long-term care home if they want. The reason that people like my client end up into long-term care is because there's no other options for them. Things like assisted living, homes that have attendant care, they have waiting lists. They're even worse than long-term care. So they might be 10 years old. And in this case, this person has no family to help support her. And so, they've ended up in long-term care because that's just where everybody ends up. It's basically the dumping ground of the healthcare system. If we don't know what to do with them, we'll put them in long-term care.
I should, because I didn't say it in my introduction, but she is paralyzed from the waist down and has epilepsy. Isn't that correct?
Yes, she has a number of medical issues more than that, but yes, those are the 2 major ones.
And as you've mentioned, there just is nowhere for people of her age with these kinds of medical issues to go in the province of Ontario.
Well, that's right. I mean, this is obviously the province has decided that long-term care homes is the place for people to go. But the problem is that all the services in those homes are geared towards elderly, frail people who have dementia. And so anybody who's outside of that box doesn't fit in. And so when you have a young person, they end up sort of scattered amongst a bunch of different homes, and the homes really don't know what to do with them. The people aren't trained in that kind of care. When they want to see, a specialist or something, it's always something to do with geriatric. So those people aren't properly trained even when they're coming from outside. It's a terrible problem. And, if there were homes for people or units for people who were younger, it would make more sense. But really, they should be in the community and not in long-term care.
Now, this isn't something we can just blame the current progressive conservative government here in Ontario. I mean, this is, I think, a long-term problem that predates their government. Can you just give us, I guess, people across the country, exactly how did we come to this problem here in this province?
So, basically it's they closed different kinds of facilities around that used to help house those younger people. They might have been chronic care hospitals. There were some institutional places, not that they were great, but they didn't replace them with anything. They said, oh, these people can go home or go to group homes. But like we saw with, in the psychiatric movement, when they moved people out of psychiatric facilities, they didn't have the infrastructure in the community. And the exact same thing has happened with people with disabilities. So if you don't have a family where you can live, you end up in this kind of institution.
Now, you describe them as a dumping ground, and we've seen pictures of, I'm assuming supplied for her from herself, mm-hmm. of where she has to sleep. Some of the meals she gets. There's one we'll show as I'm talking about it. It's supposed to be maybe shepherd's pie, but I don't know. It looks pretty horrible. And I've heard, since coming to Ontario, this certainly in the news here, I've heard horror story after horror story. So I mean, what's it going to take, I suppose, to get movement on this?
Well, certainly we're hearing from the Premier just in general that long-term care needs an overhaul, and that's absolutely 100% and absolutely predates this government. It's been a problem for many, many years, probably since I started 25 years ago. With respect to young people, I think it just doesn't get a lot of press. It doesn't get a lot of light shine on it. People just don't know that there's young people in there and don't understand the issues that people who don't sort of fit that elderly mold, what kind of problems they have in long-term care. And so we have to do a much better job in providing attendant care, group housing, specialized care facilities for people who have other needs other than the elderly.
Now, I know that in these homes, a lot of the heavy lifting literally is done by what are called PSWs, and I have to admit I forget what PSW stands for, but they're not paid very well.
Right.
Is it just a matter of paying more people better so that we don't see what we're seeing right now?
So PSWs are personal support workers, and in long-term care homes, they have to have a minimum amount of training. That's in the legislation. In other settings, PSWs don't actually have to have that training. So you could, be getting a lot of other things other than a trained PSW. There is a training component. There is a money component. So we have to train them better. We definitely have to pay them better. Part of what we're seeing now are that the PSWs in long-term care were having to work in multiple facilities, sometimes because they couldn't make enough working in one, or they couldn't get enough hours in one, so that the homes were saving on benefits, so they had to work in multiple homes. But at the end of the day, many of these PSWs are trained to give care to the elderly, and they are used to giving care to the elderly. So someone who is young and asks that things are done in a certain way, for example, so this would be a very common problem that I would have with young clients, is that they'll say, please put this over there, or please do this treatment in this certain way. And the nurses and the PSWs, they just want to do it their own way, which they're used to with people with dementia who can't instruct. And it becomes a huge battle in long-term care with younger people.
Now, Ms. Meadis, the Ontario government doesn't track Indigenous identity in these homes. Have you come across many Indigenous people while you've been doing your advocacy work?
We don't get a lot of calls from Indigenous people. There are Indigenous long-term care homes that provide services in those areas, and they would be more likely to be served by their local legal clinics, who will call us for support if they need.
Now, for this particular person, and I'm referring to this 27-year-old woman we talked about earlier in our conversation, what would she like to see happen to improve the quality of her life?
Well, first of all, she needs to get out of that home. She needs to go into another home. In the long run, she needs to get into an attendant care setting of her choice, where she can get the proper care and be surrounded by people who know how to care for her needs and her peers.
Do you know how concerned she is now that the COVID-19 virus is spreading quickly and widely through long-term care homes here in Ontario?
Well, she's very concerned. She's in a home that does have an outbreak status. She has not been swabbed. She tells me that staff have not been swabbed. So she's very concerned. She's also concerned about infection control precautions. While the staff seem to have enough PPE, there's a real question about whether or not they're doing things like washing hands between residents. So they may have gloves on, but the gloves may not be washed between residents. So she has a big concern around the infection control and her potential to catch the infection for sure.
Finally, I wanted to ask you personally, how did you get into this type of work in the first place?
Well, I practice in the mental health and disability law, and then when the job came up at the Advocacy Center for the Elderly, I took it. That was about 25 years ago, and I've really enjoyed working with seniors and dealing with these issues in long-term care homes and other congregate settings where some of the most vulnerable people in our province live, often with no other people to support. So it's a really great job.
Now, you probably mentioned it earlier on, but what's been the most frustrating thing over those 25 years?
Well, I think cases like this are very frustrating. We get a fair number of them where people are put into long-term care where they really shouldn't be. And then the other very frustrating part is that, of course, we know all the problems in long-term care. What is being highlighted these days with COVID-19 is nothing new. They're the same issues that we run into every year with flu outbreaks and other kind of infectious diseases. Lack of staffing not showing up because they're sick, not having enough PPE. These are problems that we've had for a long time. They've known they needed to rebuild these homes so we didn't have 4 bedrooms. And it's just all of the things that we've been talking about and warning the government and anyone else who would listen have all now under a microscope because of this terrible disaster.
Well, hopefully this terrible disaster will improve things afterward. I want to thank you again for spending some time to talk to me.
Thank you for having me.
After the break, we speak to a First Nations woman battling food insecurity during this crisis. Welcome back. Earlier this week, the Trudeau government announced $250 million to help farmers and food producers. $50 million of that is to buy surplus food like poultry, dairy, and potatoes, because too much is being produced and going to waste because markets have dried up. Our next guest already knew that. Tanya Cameron has become a potato dealer and has sent 4,500 kilograms to lower-income families in the Kenora, Ontario area. Cameron is a former band councillor, has run federally for the NDP, and is currently a regional coordinator for the Indigenous Sport and Wellness Council. Welcome to Nation, Ms. Cameron.
Hi, thank you for having me.
First off, how did you become a potato dealer?
It was actually quite unexpected. In my organization, ISWO, we discussed how we're going to shift our programming. One of the biggest needs in the Kenora area was food, and one of the biggest things we're also facing is food insecurity. So one day, while scrolling Facebook Marketplace, I saw an ad for potatoes. One of the local farmers in Manitoba desperately needed to offload potatoes. So that's what started it all.
And he just gave these to you for free?
No, actually, they were trying to break even because farmers, they need to supply for their own families as well. So they gave us an incredible deal of $15 a bag, and each bag was $50. So I coordinated local sales here, and I got ISWO to sponsor the freight to bring, I believe it was 10,000 pounds and over 2 shipments to Kenora, and local First Nations took advantage of that deal. Also, about 3,000 pounds were donated by buyers who would say, I'll buy 1 bag, add another 2 to the list, and donate it to families. So that's what we did.
You mentioned that First Nations are getting some of these potatoes, but who else is benefiting?
So we had a number of buyers from communities in Shoal Lake 40, Shoal Lake 39, Anigaming First Nation. My own community, Nisatchuan, had bought a load of potatoes as well. And it's just worked out incredibly well.
So what do you think of this $50 million buyback program recently announced by the federal government? The idea is that these surpluses may make their way into food banks.
I think it is very important that we help our farmers, and we also help our low-income families that are in need of things like potatoes. It's definitely a welcome announcement for our communities. Again, the farmers are trying to just break even. We don't want to hurt our farmers financially. And another farm has since reached out just on Monday. They saw some of the press that my work has been generating. So we are working on another round of a 3rd potato run for next week. It's exciting.
I didn't know potato runs could be exciting, but they certainly are in this time.
Neither did I.
Now, you said that 120 22 kilogram bags of potatoes to a remote community would cost more than $5,000. So is this where you'd like to see the federal government help out?
Yes, just the transportation of one trucking in potatoes to northwestern Ontario and then getting them to ports like in Red Lake and Sulakout, those costs it's incredibly high. One quote I received from a smaller airline in Red Lake this morning was 2,500 pounds of potatoes was $2,000. So I don't want to transfer that cost to First Nation communities and their families. It's just, it's too expensive. I believe I broke it down at the end, if we went full flying from Manitoba, it would be $65 a bag for a $15 bag of potatoes. So I'm aggressively working on seeking sponsors and donations to cover the cost for First Nations families to receive the potatoes.
What about the local food banks there in Kenora? Will this help them, this buyback program?
It can certainly help. I know in the last potato run, we gave, people are buying additional bags for donations. I was able to send bags to our local fellowship center, the Métis Friendship Center, and the Métis Council. This time around, it would be good to support our local food banks in our municipalities in northwestern Ontario. I know the other day the Salvation Army Kenora Food Bank had put out a request for donations because their shelves were getting bare. Again, food insecurity in our communities is huge, and we need to do all that we can to support our families.
You talked about food insecurity, especially in remote communities. There's a program called Nutrition North. Does that help in any way?
Yes, I actually had a conference call this morning with Fresh Market Foods in Sulakout. They successfully got a grant to help with shipping of foods to the north, so they are eager to partner with me in getting this potato deal to Sulakout. So we're looking at getting another 10,000 pounds next week to Sulakout, and they're going to help me get those communities to the north. I'm so happy with the way things have been taking off.
A few weeks ago, Northern Affairs Minister Dan Vandal announced $25 million to Nutrition North to boost subsidies. Has this made its way to the ground to help northern communities?
I believe First Nations did receive funding, and they are very, they have to be creative to make sure that they don't expend right away, and we don't know how long this pandemic is going to last, so I know they have to conserve their funds to make sure that they get exactly what they need. One of the big and sad things I saw last week was one community posting that they have enough toilet paper to give one per household in their whole community. And I just thought, my goodness, we're dealing with such a need in our northern remote fly-in communities. And a lot of us, and even Kenora, don't understand. If we're worried about our food supply, it's more dire in northern remote communities.
I suppose that begs the question, what more can the federal government be doing right now?
Well, certainly if the federal government would buy out those potatoes from the farm that I'm working with, I can certainly work on getting it shipped to the communities in need. And this is both on reserve First Nation communities and our Indigenous families living off reserve in the urban centers.
Now, of course, these subsidies and these programs are kind of temporary. So after this crisis is over, what lessons should we be learning in getting food to vulnerable people?
Well, I think everyone, this has been an eye-opener to a lot of my friends in Kenora and donors from Southern Ontario to see the actual cost of shipping much-needed food in the north, especially during these pandemic measures. I think the eye-opener for a lot of our communities are they're looking into agriculture. I'm not sure how well that would work given we have a short planting season, but I know some families and some First Nations are actually looking and investing in community gardens, because this has been an eye-opener of how reliant we are and how important our food system and how we have to be able to manage through crises like this and ensure that our members have access to quality foods.
Well, let's hope that we can learn some lessons. Ms. Cameron, I want to thank you for speaking to me.
All right, thank you.
We'll have more after another short break. Welcome back. Former Green Party leader Elizabeth May is not known for holding back. At a press conference, she declared oil is dead because of reduced demand due to COVID-19. And she called Alberta Premier Jason Kenney's request for a $30 billion bailout of the energy sector misguided.
I think on this, Jason Kenney couldn't be more wrong. It would damage our economy in Canada significantly to put money into a sector that can't come back. You need to put money into the sectors that have a real opportunity. There are disruptive technologies happening right now, just as disruptive to the horse and buggy, the way the Model T Ford was disruptive, just as much as Blockbuster Video thought it had a solid business proposition till Netflix came along. That's the kind of disruption we're seeing in the energy sector.
As well, a reduced number of members of Parliament were back in Ottawa yesterday, including a couple of Indigenous ones. Jody Wilson-Raybould asked the Health Minister about seniors, especially in light of how devastating COVID-19 has been in long-term care homes.
As other members in this House have commented and asked questions, I'm wondering if the government will be setting national standards for long-term care.
The Honourable Minister of Health.
Thank you, Madam Speaker, and I was very pleased to work with my colleague, the Minister for Seniors, on a set of national guidelines that can help reform long-term care and in particular during this crisis to reduce the number of infections in long-term care all across the country. Those guidelines were developed in partnership with provinces and territories. We all agree more has to be done, Madam Speaker. We all agree that we need to take better care of our seniors no matter where they live in this country.
Mumilok Kakak pressed the government for when Nunavut will get COVID funding promised back in April. $30.8 million for social and health preparedness.
Now, with the vulnerability in the communities that I see in my riding, this has the potential to be much more fatal than many other places throughout Canada. So why have we not seen this funding come through yet?
The Honourable Minister.
Again, Madam Speaker, there are a number of funding envelopes that have flowed to the north, including $45 million through ITK and the land claims organizations directly to protect the Inuit people and prepare for something, as the member says, that no one can really predict the outcome of.
A few weeks ago, I mentioned the Hope for Wellness helpline, which you can call if you're feeling stressed out about COVID or anything else for that matter. Minister Miller said it's being beefed up.
We've increased the number of crisis intervention counsellors on shift at the Hope for Wellness helpline, which is now receiving more than 100 calls or chats a week linked to COVID-19.
That wellness number again is 1-855-242-3310. Counsellors who speak Cree, Ojibwe, and Inuktitut are available. Well, that's our show for this week. I'm Todd Lamoran, hoping you're safe and healthy, and thanks for watching.